Stereotactic biopsy uses mammography and computer technology to pinpoint very small calcifications or masses in the breast. Using a biopsy needle, a small amount of tissue containing calcifications or a mass is removed to be studied under a microscope by a pathologist, a type of specially trained doctor. This type of biopsy can answer whether the area of concern contains benign, meaning not cancer, or cancerous cells. During your biopsy, you will lie on your stomach with your breast positioned through the opening in the middle of the table. Your breast will be compressed to keep it from moving, and x-rays will be taken to accurately find the suspicious area inside your breast. After the area is pinpointed, you will receive a local anesthetic through a very small needle to numb this area. Once the skin is numb, a small cut is made in the skin through which the biopsy needle is placed in your breast. Samples from the suspicious area will be taken through this needle. During the biopsy, you may feel pressure and possibly mild discomfort. You will continuously receive numbing medicine throughout the biopsy through the biopsy needle. If you feel sharp pain, let the person doing your biopsy know, as they can give you additional numbing medicine. It is very important to be very still during your procedure. Please do not lift your head or shoulders. Several x-rays will be taken during your procedure. It is also very important to hold your breath when these images are obtained. We will warn you when you need to hold your breath. The biopsy device makes popping and whirring sounds, which you will hear but should not feel. Once the tissue sample is collected, we may take an image of the tissue taken from the breast to determine if more samples need to be taken. Once the tissue sample is collected, using the same needle guide, a titanium marker, or clip, is placed in the breast where tissue is removed. This marker marks the spot of the biopsy in case that additional procedures are necessary. You will not be able to see or feel the biopsy marker. The marker is safe in the MRI machine and will not be detectable at the airport. It shows up on the mammogram as a white spot. After the biopsy, pressure will be applied to your breast to stop any bleeding. You may get a Band-Aid or Steri-strips covered by a Band-Aid where the needle went into the breast. The Band-Aid can be removed the next day. If you have Steri-strips, they will fall off on their own in about a week. If still remaining after a week, you can gently remove them. Next, a gentle mammogram is done to show the clip. The benefits of this biopsy are to get tissue to find out if the area seen on your recent mammogram and/or ultrasound is benign, not cancer, or cancerous. Although we feel that this type of biopsy is the best option, there are other options for you to consider. These include open surgical biopsy, imaging follow-up, or doing nothing. As with any medical procedure, there is a small risk of experiencing a complication. The complications include bleeding, infection, the need for more procedures and treatments, a non-diagnostic sample, or possibly an allergic reaction to the local numbing medicine. Besides some bruising, the other potential complications are extremely rare. We will take all possible precautions to minimize any chance that you experience any complication related to this procedure. The tissue sample will be sent to a laboratory for study under the microscope by a pathologist, a type of specially trained doctor. The pathologist will send the results of your biopsy to your provider. Your provider will call you with results and recommendations for further care, if any, within 3 to 5 business days after the biopsy is performed. After the biopsy is completed, it is important to keep the area clean and dry. We ask you to avoid showering or bathing for 24 hours. You should not lift anything heavy, in general more than 10 pounds, for 24 to 48 hours. To relieve pain and decrease swelling, you should apply ice packs to the affected breast at least 3 to 5 times over the day and evening. If there is soreness the next day, it may be helpful to continue to use the ice packs for another 24 to 48 hours. Also, we ask you not to submerge your breast in water until the skin has completely healed, usually about 7 to 10 days. So, you should not soak in the tub, swim in the pool, or sit in a hot tub until everything is well healed. You will be given printed instructions on how to care for yourself after the procedure. We welcome your questions regarding your biopsy and look forward to taking care of you during this visit.